According to the World Health Organization, over 40% of men suffers male infertility, but most men blame their childlessness on their wives. Hello and welcome to Health Talk. My name is Oluwatoyin Abo. Our topic of discussion today is male infertility, and I have a gynecologist here to give us a clearer perspective on this topic. Let's have a chat with him. I'm now being joined by Dr. Oluwarotimi Akinola. You're welcome to the program, sir.
Thank you.
Thank you for having us. So, Dr. Akinola, what exactly is male infertility?
We should talk about male infertility, except we really define what infertility means. Infertility really means the inability of a couple to achieve pregnancy in spite of regular unprotected intercourse of 12 months duration. So basically what we try to do is that you want to know, to attribute it to factors, know who is responsible. Since we say it's a couple thing, individuals are not infertile, only couples can be. So we say, for example, that if it's something that's got to do with the male, then it's male infertility. If it's something that got to do with the female, we say female infertility. Then if it's something that's got to do with both of them, and then they put figures to that, actually, though those figures have been varying. What is said, basically, is that 1/3, that's about 30% of couples who do not achieve pregnancy, that the male is solely responsible. That's a bit stale now. We're talking about 30 to 40% now of infertile couples. That is a male factor problem. We're also saying that female factor is about 30% or thereabout, and then both of them have one fault or the other in another 30%. And so anything from 0 to 10% is what we are not too sure of what's responsible, which they say is unexplained infertility.
Let's move to the causes now. What are the causes of male infertility?
If the testis is not producing good sperm, then you say there will be male infertility. What are the reasons why the testis might not produce good sperm? Right from birth, you can have what they call chromosomal makeup. That's when a female has a chromosomal combination of what we say XX. For example, a male has XY, but anywhere there's a Y, it's going to be a male that comes. So if you have XXY, they call that Klinefelter syndrome. It's going to be a male, all right, but it's going to have testicular atrophy, though the testes will not be producing good sperm. So you have those genetic problems, and so you just find out, for example, that the testis is incapable of producing it. There are other issues. For example, anything that affects blood supply and all that to the testes would also probably contribute to poor sperm production. So you think you have, some saying about 1% or something, and all that sort of thing, of cases where varicose veins that go into the testes can actually be responsible for, they call it varicocele, that can actually be responsible for that. Oh, there are several other factors, like they talk about smoking, they talk about alcohol abuse and all those substance abuse, all those things causing that. Infection like sexually transmitted diseases could damage the testis, could also damage the pathway, which means that it could damage the testis to such an extent that it's unable to produce gonorrhea, chlamydia, and all those things that can cause that. But then again, it could also cause inflammation along the pathway, tuberculosis, whereas the sperm is produced, it cannot be deposited. You have viral infections from childhood, like mumps, which people talk about. Mumps in childhood causes not only inflammation of the parotid gland, it also causes inflammation of the ovary in females. It causes inflammation of the testes in males. It could cause so much damage that the cells that are left to produce sperm are also limited, and so you can also have that kind of problem. You also have those cases, for example, where the sperm is produced all right, but it cannot be deposited. You probably call that erectile dysfunction. So we're talking about things like impotence and all that. which can also be factors that are responsible.
Are there some drugs or diseases that can predispose a man to this kind of condition?
Unfortunately, there are some almost anecdotal, some really, really, really so. I am aware, for example, that drugs like anti-ulcer drugs, like cimetidine, and a couple of other drugs that people take have been known to be associated with reduction in sperm quality production. And I said drug abuse. So all those are things that could have an effect.
What are the symptoms of infertility in a man?
There is only one symptom that I know, and that is the fact that the person religiously copulates with his wife, and after 1 year, they are unable to achieve pregnancy, and you investigate the couple and find out that the problem is solely with the male. That's male infertility.
I haven't had all this now. What are the treatment options that are available for treating male infertility?
Treatment of male infertility was regarded as uniformly unrewarding. As uniformly unrewarding. We've had a lot of anecdotal studies, anecdotal pronouncements that you take this drug and all that, particularly these days when you have a lot of drugs that this. You see, there's also this principle that there's something called effect of stress. So they call it oxidative stress, that free radicals are produced when there's no blood and other poor blood supply and everything to the testes, so it damages it. So people now talk about if you're using such drugs, and there are legion, they're also in the market, that they can improve this. We don't have too much evidence to support the fact that they actually do. I'm also aware that for a very long time, doctors did something, which is also a bit ironical. They also give male hormones, because the testis produces two things. The testis produces male hormones, and the testis also produces spermatozoa, the sperm. So if you give male hormones, it makes the man more macho. He's more of a man. But you see, because the testis produces male hormones locally, which births the Leydig cells and Sertoli cells that produce the sperm. So local effect makes you produce better. But by the time you take it by mouth or injection, what it simply does is that it shuts down the system that makes the local production. So it goes to the liver and so all that. So it's more like a counterproductive when it is used. But be that as it were, it is possible, absolutely possible. We had things that were done empirically in the past. Cooling of the testes. When you think that people cool the testes in the morning, cold water in the morning, cold water in the evening, avoid hot baths and all those things, were said to improve this. People also have very small percentage of cases where the problem actually is that you don't have enough stimulation from the brain.
What is the place of surgery in the treatment of male infertility?
Thank you for that question. I did say in a very small percentage. The problem really has to do with varicocele. Varicocele actually is like varicose veins that descend into the testis and take blood there. You know, the testis is supposed to hang like in most mammals so that it can be cooled. So if the temperature at which it is operating is too high, then what you're going to get is not only reduced number of sperm, you're also going to get a lot of them being abnormal and all that. We call that astenospermia. So in that case, if you can diagnose that there are varicoceles there, sometimes you go in for surgery and tie those vessels. And then if too much damage has not been done to the testis, we've had cases where you've seen such patients recovering after about 70 days, because it takes 70 days to produce one sperm. So after about 70 days, you begin to see gradual improvement. And such patients have responded to that treatment. So it is also a possibility. It's just that it's not so widespread, because varicocelectomy, that's cutting the varicose veins.
As a gynecologist, how will you advise men to prevent themselves against male infertility?
Education is one. Really going out there, enlightenment, so that people will know. If you prevent the development of sexually transmitted infections, you'll be taking a big chunk of causes of male infertility off. If you're talking about substance abuse, you're talking about excessive use of alcohol and all those things, you'll also be doing a good amount of help to males. We're talking about you're wearing tight pants and all those things, and then I told you about prolonged riders who ride a lot. In the past, it was common that people worked in chimneys, people who worked in the railway, who are stocking chimneys and all that sort of thing, that they should reduce exposure to heat. And so those are the areas really that you can influence if you really, because it's not often, people don't even know, most men do not know that they have male infertility until it has happened.
So the most important thing is that men should avoid wearing tight underwears, and they should stay away from infection whatsoever, because infection is one of even the leading cause of male infertility. It has been so nice speaking with you on our talk, sir. Thank you very much. You've added from our experts, men should avoid wearing tight underwears, and they should stay away from any kind of thing that can expose them to heat. That's the topic today, male infertility. Join me again next week. My name is Oluwatoyin Abo. Bye for now.